Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights. Lagos State Government beams its searchlight on abattoirs in the state, sensitizes on the dangers and preventive measures of COVID-19. As schools reopen in Niger State, the issue of safety protocols to COVID-19 is brought to the fore again. And today marks 6 months since the WHO declared COVID-19 a global pandemic. The number of confirmed coronavirus cases worldwide has topped 28 million. We begin with 2 new laboratories that have been activated for inclusion in the NCDC Molecular Laboratory Network. They are the Test Tube Federal Medical Center Gene Expert Laboratory, Benin Kebbi, and Test Tube Plateau State Human Virology Research Center in Plateau State, Nigeria. This puts the total number of labs completed across the country to 71. As of today, only 35 states have been added to the NCDC Molecular Laboratory Network, including the Federal Capital Territory, with the exception of Niger State. As at today, Nigeria has tested 436,231 samples of COVID-19, confirming 55,829 cases. It has recovered, the number of people that have recovered are almost 44,000 at 43,810, and 1,075 deaths have been recorded in the 36 states and the FCT. In the meantime, 5 deaths were recorded in Nigeria last night and 197 new cases reported by the Nigeria Center for Disease Center from 13 states. According to the Africa Center for Disease Control and Prevention, COVID-19 update in Africa shows the numbers have climbed and are at over 1.3 million. Total deaths have risen to 32,117. Central Africa still has the lowest of the cases on the continent at 55,861, followed by Eastern Africa, 149,151. West Africa is in third place, of course, where Nigeria is, and Nigeria is leading in that region. And after which you have Northern Africa at 261,611 cases. Southern Africa retains the #1 position with the largest chunk of coronavirus cases at almost 700,000. Remember the outbreak of the coronavirus traced to a major wholesale market in Wuhan, China? Well, the Lagos State government is working on ways to reducing the risk of spreading COVID-19 by reviving the enforcement of the Lagos Meat Reform. According to the Acting Commissioner of Agriculture, Mrs. Abisola Odusonya, the policy entails the closure of abattoirs and slaughter slabs, which do not meet up to the operation protocols that ensure that only safe meat is available in markets for Lagosians.
The COVID-19 pandemic, or the virus as it is, it started in Wuhan, China, in a wet market where they're selling meat. And if you also have illegal slabs, people's backyards where they are slaughtering meat and there's no vet doctor to certify, then what are we doing? We are killing ourselves, all in the name of, oh, it is the way they earn their daily income. It's just like you saying, oh, why can't NAFDAC approve for everybody to own a chemist, regardless of the fact whether those drugs are certified for good consumption or not? Then we might as well just let anyone run a chemist or a pharmacy and say, oh, after all, they are also earning their daily living. So we cannot keep using this kind of excuses to augment or to legalize something that is illegal. There are standards, there are procedures to having a slaughter slab or an abattoir. So long as you are within the confines of that policy, of that law, nobody will come near you. But if you are doing it in an illegal manner, then you don't expect us to legalize it, all in the name of, oh, that is the way you earn your living, or that is the way you see it fit to, operate your business. What can we do to ensure that at the end of the day we have a sanitized value chain system to ensure that the Lagosian gets a good quality meat at good pricing, and with the stakeholders also being able to maximize the benefits of the business they do within that chain. So one leg of it is the abattoir, which is where the monitoring, enforcement and compliance comes in to ensure that illegal slaughter slabs are shut down. Then the next stage within that bucket is to ensure that even the slaughter slabs that are government approved, are they also following procedure? Are they also following standards?
Meanwhile, butchers in Kwata meat market are appealing to the state government to give them more support in order to enhance hygiene and safety protocols in the market. The Kwata meat market houses an abattoir that attracts customers from over 7 neighboring communities and extends to Nkwo and Onitsha, with over 30 cows killed daily, albeit before the coronavirus pandemic disrupted business. According to the chairman of the Butchers Association, they are working hard to improve the sanitary conditions.
Kwata Abattoir is in a central location in Oka, the Anambra state capital. Constructed over 40 years ago, customers come from several communities around Oka and Nkwo and Onitsha to patronize the butchers. The abattoir is demarcated in sections which include the pond area where the washing of the meat takes place. There's also a section for burning. Here, the butchers use only bamboo and not plastic or rubber products as a standard practice. Then the selling area where the customers can make their choice. But the butchers are not happy with the state of things, despite the amount being generated for the state.
Before we kick out, we have an veterinary, we have an emala. We will come very early and check the type of cow, the type of goat, the type of people. So we just taking our food very carefully.
Keeping the abattoir environment clean is their priority, and they are appealing to the government to construct a drainage network around them.
All the whole land is too dirty because we are doing our own capacity to do the press to be normal, but there is no money to continue the job. So that we need government to help us, especially to do gutter for this very press.
The abattoir environment, no doubt, needs to be fixed, and the State Commissioner for Health says that the government is coming up with a modern infrastructure that will be a model for new slaughterhouses.
They have a large general abattoir. The animal comes in, rested, and the animal will be inspected by the veterinarians, and then the health officers will come around and inspect the animal during the slaughter process and make sure that the animal is healthy. And then the environmentalists will make sure that the effluents from that area, the waste products that are produced, are disposed of in a good manner.
While the butchers wait for the advanced abattoir to come to reality, they maintain that the earlier the government supports them, the better, because the resources they put into the running of the place is taking a toll on their business.
In Calabar, the Cross River State capital, residents are describing the constant use of the face mask as uncomfortable. A visit to the popular Wart Market and Etimedem Motor Park reveals that about 90% of buyers and traders didn't have their face mask on. Here's what some of them had to say.
Actually, this face mask is type by type. Some of them you can use it and speak very well, louder. Just like this one, it's elastic. Then some of them you can use it, you cannot be able to speak, even breathe in, because you can suffocate anyone.
It's not easy. You just have to allow some air, you know. As you can see, I'm not even wearing one now. Unless there's a cure. If you get sick, you go to the hospital and get treated, that's all.
We are not comfortable with it. We are not comfortable with it because it will block our nose. But we normally use it. Like me, I have it, but I don't use it now.
Well, let's look at the efforts to curbing the spread of COVID-19. We have joining us from Abuja studios, Mr. Peter Anamarie. He's a clinical pharmacist and head of department at Asokoro District Hospital. Thank you for joining us on the program.
You're welcome.
I want to start with some of the numbers we're seeing from the FCT. The cases and admission about 3,689, and it has recorded 71 deaths since the first outbreak. Tell us what you've observed as to some of the measures to flatten the curve in the Federal Capital Territory.
Thank you very much. As with the FCT issue, now the curve is a good one. For that matter, is an excellent one for that matter. From the figures we have about 71 deaths out of about 2,869 infected cases. Now, we are talking about human lives here. It would have been the joy and the happiness of everyone involved, especially the relatives of those who died as a result of the infection, the caregivers, and even the government that is funding the treatment, that will record 100%. But due to some unforeseen circumstances and some variables involved in the treatment and management of the infection, we unfortunately lost some of them. If you look at the statistics, the percentage of the loss is like 1.9%. That means the success rate is like 98.1%. And I think that is a good performance. And this is due to the doggedness of the FCT administration in tackling the issue. Opening up of treatment centers and provision of PPE and other things required to manage the infection. I think the curve has been an excellent one in FCT. Thank you.
Now, Ms. Anna Marie, it appears that as long as, there is no cure for COVID-19, face masks and other personal protective equipment would continue to be in high demand. Do you think that we can continue to sustain these non-pharmaceutical measures if we don't locally manufacture enough to meet population's demands?
Based on the economic situation in the country right now, it may not be possible to sustain the demands, to meet the human demands of these non-pharmaceutical appliances and face masks and PPEs. It is necessary, and the government should take it as a point of duty to bring enabling environments for local manufacture of these non-pharmaceutical equipments. Now the government can start by providing power, bringing in sustainable and affordable power supply, because the industries and where these things are manufactured need power to work. So there must be sustainable and affordable power supply. Government can also waive or even bring down to the barest minimum taxes and duties paid on the items that may be needed to be imported to manufacture these items. If these things are done, and this is in the purview of the government, and we believe that the government can do these things, if the things are done, we believe that the things can be manufactured locally, they can be affordable, and then they will be able to meet the demands of the populace.
Appreciate your time. Thank you so much, Mr. Peter Anna Marie, Clinical Pharmacist, Head Department, Socorro District Hospital. Thank you for joining us on the program.
Thank you very much. My pleasure.
We have more on the COVID-19 updates when we return. Please stay with us. Welcome back. Cinemas, film houses, eateries and hotel restaurants can now operate, but only at 50% capacity, while ensuring all COVID-19 preventive and safety protocols by the NCDC are observed. The Delta State Commissioner for Information, Mr. Charles Aniago, made the announcement while briefing newsmen in Asaba. He also cautions that the state government will monitor operations to enforce compliance, calling for places of businesses to be fumigated regularly. He, however, says that clubs and lounges remain closed until government comes up with safety modalities for their reopening.
Owners of movie and cinema houses can now operate, but they can only do so at 50% capacity, in which case they are not going to just fill everywhere. 50% of their capacity, like for instance, if a theater is meant to take 50 people, it means they should organize it in such a way that they take 25 persons per time.
It's been over 6 months since the coronavirus hit and schools were shut down to contain the spread of COVID-19. With lockdown easing up around the world, the Niger state government has announced that the primary schools across the 25 local government areas of the state will reopen on Monday, the 14th of September, for pupils in exit classes. Our correspondent Emperor Simon tells us more.
The Niger state government says it is confident that pupils in exit classes in primary schools can now return to school, especially to write the National Common Entrance Examination. And that's after training over 3,000 head teachers from across the 25 local government areas of the state. This is a cheering news, especially that schools have been shut down for more than 6 months now. The chairman of the Universal Basic Education Board in the state says that without iota of doubt, the safety of the pupils will be guaranteed.
The reopening process has just begun today with the training of head teachers as sponsored by Universal Basic Education Commission in collaboration with the Niger Suburb. As I'm talking to you, over 3,222 head teachers are undergoing training today and tomorrow for that is going to give a kind of a signal for opening of our schools. And I want to assure you that by next Monday, we are going to open primary 6 classes for examination purposes. However, we're not opening for all the students, for only candidates that we have registered for examination. We're opening for only the candidates that we have registered for examination. I can assure you that we have a maximum number of 500 children that will resume schools in various local governments. That is to say, in each local government there will be 20, and they will under the guidance and tutelage of their teachers for the purpose of examination. After the examination, we'll await the decision of Niger State Commissioner of Education on the matter of opening of schools.
Niger State currently has a total of 244 confirmed positive cases of COVID-19 with 12 deaths. At least over 2,000 suspected cases have so far been monitored by the state task force on COVID-19. Emperor Simon for COVID-19 update.
Now, the World Health Organization, WHO, declared the COVID-19 outbreak a global pandemic as the novel coronavirus rapidly spread across the world. Let's take a look at the timeline of WHO's response before the declaration. December 2019, the COVID-19 coronavirus infection emerged in Wuhan, China. The 31st of December, China alerted the WHO of several flu-like cases in Wuhan. Now, the 5th of January 2020, WHO issued a statement that advised countries against applying any restrictions on travel or trade with China based on the status at the time. However, the virus had rapidly spread, requiring WHO to reassess its severity. Now, the 22nd of January saw WHO Emergency Committee meet to discuss about the outbreak, and this was postponed to the 23rd of January. When that day came, several committee members considered it still too early to declare an emergency. Now, the 26th of January, WHO declared that the global risk from the novel virus is high and not moderate as previously reported. 30th of January, the agency's emergency committee declared the outbreak a public health emergency of international concern. February came, the 21st, and WHO said that the window of opportunity to contain the outbreak was narrowing. The 11th of March, the World Health Organization characterized the coronavirus as a pandemic. And it's 6 months today. It's a pandemic that is said will be felt for decades. Joining us is Mrs. Hamdalat Bola Joko, a medical laboratory scientist, also a molecular virologist. She joins us via Skype from Abuja. Thank you for joining us on the program. On this day, 6 months ago, WHO's Director General, Dr. Ghebreyesus, officially declared it a pandemic. How do you think that the world has fared since the outbreak, would you say that it's still a pandemic that is potent or an epidemic, and that we have been able to control it to some extent?
Thanks for having me. How the world has been able to fare, I would say the world has fared fairly well. It differs across board. Some countries have and still continue to struggle with the pandemic. Examples include USA, Brazil, Italy, India, to name a few. While some countries have done pretty well in the handling of the pandemic, and I would say Nigeria belongs to this group, with the stay-at-home strategy, the travel restriction strategy, the quarantine of travelers, the use of face masks, and basically other safety guidelines as advised by the WHO and the NCDC. Most countries have relaxed lockdowns. There's still a lot to learn about the virus, a lot that we still do not understand about the virus, but then there's been a lot of improvements that have been made by scientists and other health experts. So I would say that the world has fared as well as we can, given the circumstances. As to the question of whether is it still a pandemic or an epidemic? So an epidemic is when you have a sudden increase in a disease that has been existing, while a pandemic is when a new disease springs up and then spreads across countries and across continents. So ever since the emergence of SARS-CoV-2, the COVID-19 virus, the world is still struggling. We don't really have a good control of it yet. So it's still a pandemic until we can control it. If after controlling it, we now have a sudden increase again, then we can't term it an epidemic. But for now, COVID-19 is still a pandemic.
So with the different sectors of the economy opening up, what should we prioritize? And this is especially schools resuming and our children, students going to school. What should, the government, also those who are in charge of ensuring the safety measures are followed, what should they prioritize? And this is across, the states of Nigeria.
Okay, so I would say that in terms of prioritization, as regards dealing with the COVID-19 pandemic, I would liken it to walking a tightrope. On one hand, you have the COVID-19, which is a pandemic, an emergency. And then on the other hand, you have the economy, which we also cannot afford to put on hold for however it can stay on hold. So I would say that it's important that we put in safety measures to control the COVID-19 pandemic, but then we also have to start opening up the different sectors of the economy. So I would say that in terms of prioritization, the safety guidelines that NCDC have created awareness about, that the WHO has told us about, is what we should prioritize. When schools are opening, we should take into account social distancing. So for instance, the universities that are about to open, that have been announced to open soon, should prioritize this. An average Nigerian undergraduate is actually very good with the internet. They can split classes. Some students can come for physical classes while others join virtually, and this could be rotational. The people that come for physical classes this week can come for physical classes next week, and others can join virtually. We also have to make allowances for hand washing stations and hand sanitizers. I would say all the big corporations, this is the time for them to show corporate social responsibilities. They can come and support the Nigerian government in making available hand sanitizers in schools, building hand washing stations, so that while students resume schools, they can also resume in a safe environment. And then, of course, the use of face masks cannot be overemphasized.
Indeed. We would like to thank you so much, Mrs. Hamdalat Bolajoko, Medical Laboratory Scientist and Molecular Virologist. Thank you for joining us. Wishing you have a great weekend. And also the kids we heard, we could hear the background. Have a lovely weekend.
Apologies, please. Thank you.
No worries. Thank you very much. And for more updates, you can take a closer look at our website. It's channelcv.com, and you will find all you need to know. Log on for access, news and health. There's also other stories there, politics, sports, business, Africa, coming in from around the world. channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Nwokam. Have a great weekend.